Welcome to In the Clinic by Dr. Butch Levy. This month's episode is titled Clinical Treatments for Women's Issues.
Good afternoon. Thank you for coming to today's seminar, and we will be discussing clinical treatments for women's issues in this month and next month. So I wanted to present concepts that are going to be related. As a background, as a primary care doc, when I started into practice 40 plus years ago, you had to really do anything and everything. There weren't a lot of specializations that were so prominent as they are today. So at that time, I did obstetrical work, delivered kids, and had a lot of peds and did a lot of GYN, a lot of contraception. I worked at Planned Parenthood early on. And today, and over the last at least couple decades, this has been out of, I think, my domain and should be out of the domain of most men. I had 2 women associates that did all the GYN work, and I just think that that's a much more appropriate application and way of providing healthcare for women's needs. I did do a lot of Chinese medicine related to it, and actually taught some seminars with Dr. Shima on women's hormonal issues. So I'm hoping that this first seminar is going to be, basically we're going to be looking at from menarche up to age 35-ish to 40 towards perimenopause. And then next month, we will be talking more about, in depth about menopause, and not just night sweats and hot flashes, but mood changes, insomnia, depression, different changes that women go through in menopause based on their decades of life. There is a depletion of energy that can really improve the quality of life. So in starting off, just as a warm-up, this is basically the hormone cycle. And as you can see, you have menstruation, and your FSH, your follicle stimulating hormone, starts off lowish and starts going up, and your luteinizing hormone, which will create the milieu for ovulation, starts slowly changing. And over the course of the menstrual cycle up to ovulation, you can see that estradiol goes up, and then at ovulation it drops and progesterone goes up. So when we talk about this, it's the estradiol and the menstruation are considered the yin phase, and ovulation and progesterone are considered the yang phase. And it's really important that there is a coordination between FSH and estradiol and LH and progesterone and ovulation, where the system just is imbalanced, which is what we're going to see is the primary issue. So the bleeding phase, the follicular phase, is usually day 1 to ovulation. So that's considered the timing of when herbal and acupuncture therapies should be geared towards that aspect. As you can see, the formulas, if again it's a yin phase, are going to be tonifying for the yin in blood. And estrogen is dominant, and estrogen is considered yin. Obviously, ovulation, as we talked about, depends on the proper surges. And so in order to have the proper estradiol peak, to have the follicle, you have to have FSH surging in order to have ovulation and have the maturation of a corpus luteum following ovulation. You have to have the proper progesterone. So These are essentially things we've discussed a little bit. So ovulatory luteal phases are yang from ovulation until menses. Again, yin is at its peak right before ovulation, and the yin cycle then shifts to primarily yang. So the yin formulas will be stopped usually. The yang formulas will be started till towards the end of the cycle, and often needs to have some moving formulas for that last week before your cycle. So just talking about this, I just thought that reviewing some of the herbal formulas that would be of value in basically in menarche, ages 14 to 35, which is really the height of kidney energy, the height of reproduction. So when you're talking about menstruation or the bleeding phase, obviously kind of average is 3 to 5 days, but you want to either use a blood tonic like Tangwei 4 or Tahoe Song Wutang, which is kind of a blood building and moving. And I think that's important that you consider using the formula that's needed. If you're finding that people are depleted related to menstruation, then building the blood is important. If it turns out that people really kind of have a lot of cramps or the bleeding is kind of intermittent and irregular during the cycle, this will help move the blood using the Tahong Siwutang. In the follicular phase, obviously we talked about yin. If the bleeding stops at 5, day 5 through 11, Tangwei Ginseng 8, and right kidney are formulas that can be used depending on the need to tonify the kidney or the need to tonify the blood and qi. In ovulation, that surge and that warming that's needed, that extra yang, Wen Jingtang is very appropriate. And if someone's really kidney deficient, then right kidney. And post-ovulation, or about that week after ovulation, you often will use Tangwei Avodia, and it's often used in combination with both left and right kidney, depending on how cold the constitution is. But again, the idea being is that if after ovulation, the plan is to support a pregnancy, then it requires both yin and yang. If it turns out that someone's just yang deficient, then often just warming them will be effective. And then obviously that premenstrual phase, liver qi and blood stagnation, and some form of chai hu formula is used commonly. Chai san minor form is used pretty commonly. Tangwei, I'm sorry, that's Tangwei and form. So these are some other aspects that I think are important. This is a couple of pages of lists that I always used to keep around so I could have referral about what I wanted to do. And I think you're going to notice in these is that we're going to see supporting the nourishment and development of blood through the spleen, warming people up, and supporting the blood, whether it's deficient or heated or stagnant, are going to be the way that things need to be dealt with in these settings. So somebody that always has an early cycle often have qi deficiency or blood heat, or sometimes even both. But obviously early, the qi is not able to hold it in the vessel, so to speak, and the blood makes it much more active. Late periods are people that tend to be cold and deficient, and they often will have stasis of the blood due to the deficiency. Irregular periods, liver blood stasis, liver qi stagnation. Sometimes as people approach later 30s, spleen and kidney deficient. If again, the amount is heavy, then often Qi deficiency, unable to hold the blood, or blood heat where it's really kind of moving really quickly. And again, scant cycles are blood deficiency or stasis, or cold, or combined with cold. So you can kind of see that when you start questioning what's going on in the cycle, you want to know what the average cycle length is and the amount of flow, and then often the consistency. And again, we're getting to blood stasis or cold when you have clotted blood, and heat when you have fresh clots with blood moving. I think one of the more interesting ones is the things that go on with pain and period pain that occurs just before the period is stagnation, and usually once there's movement with the cycle and bleeding, this gets better. During the period, often heat or stasis of the blood. Pain after the period is blood deficiency. And I actually have seen a number of people that get pain just at ovulation, and then it passes, and we're talking damp heat. So looking at the cycle length, looking at the consistency of the bleeding, do they have pain and when? And oftentimes just evaluating what it is that the cycle is producing. Someone says, I have an abnormal cycle. And it's kind of, well, it's sometimes a little late, and I have some pain, and, yeah, there are some clots, but going into more detail about when does the pain occur and what does the bleeding look like, and what is the length of the cycle? What are the things that individually determine how the person is doing? And I think what you'll find is that a number of consistent points will develop as a result of what the patient is having in terms of each of these features. So the first problem that I'm going to look at today is endometriosis.